150 years ago, the majority of, doctor visits and even for acutely ill hospitalized patients was in the home. And it's kind of ironic, as our technology improved, there was a bunch of things we had to do in a brick and mortar hospital. But now, 2022, we have a much better remote and wearable technology. It's a shift back where patients are at home.
I always felt like I was a burden when I was in the hospital because somebody would have to come over there and somebody would have to come and get me, and it was just a mess. And here, nobody had to come and get me or do anything for me. I could do it myself, and that's what I liked.
So I could just remember her just with her head down, kind of crying a little bit, and I'm so thankful. Thank you for so much you guys have done. And so I think that was really a great moment for Margot.
We are trying to really provide great experiences for our patients, be more efficient in the delivery of care, and treat patients where they want to be treated, which is typically at home.
Over the last 3.5 weeks, the doctor's been saying you need to go to the emergency room. But I didn't want to go because I knew if I got there, they'd put me in the hospital. When I got in there, they came in and told me about this hospital in the home. And I was jumping for joy.
Our model is patients that either were in the emergency room or admitted to the brick and mortar hospital who meet inpatient criteria will be transferred home, and then our team will have a community paramedicine person who will visit the patient in their home twice a day. Simultaneously, our registered nurses will be in our command center, and they will be videoing in while the paramedics in the home. And we will deliver IV medicines, we'll draw labs, we'll do monitoring. Physicians will visit virtually once a day. We'll have specialty consults. The last members, we have nurse practitioners that will do in-home visits as well. We intend to deliver hospital-level care while the patient's in the comfort of their home for the entire hospital stay.
We bring the entire technical stack into the home. That's important because sometimes you have to exclude people because they don't have that digital capability at home, and so we've taken that out of the equation.
It's a true hybrid where we're doing a lot of virtual care, but we also have an in-home, on-the-ground presence.
All I did was push a button or pick the phone up. That was it.
So we launched July 19th. We're very, very excited to actually admit our first patient that morning. With our very first patient, it really showed what kind of impact this new care delivery model could make.
I could be in my own home and still get the care I needed to get back into feeling better was such a blessing. It really exceeded my expectations. This was here and ready to go, and that's the thing. It was perfect, absolutely perfect.
Seeing patients virtually like this through the tablet really gives you a chance to slow down, talk about how you're really feeling today, even like future care, where you want to go. I feel like I finally can give them the care that I as a nurse want to give. This model of care is truly patient-centered. We've heard over and over again how excited they are that St. Luke's is now offering this program.
The patient ends up in a better position to manage their illness when they leave the program.
I think the opportunity for us to be in their home and to see some of their social determinants of health, what are some of their barriers to getting their medicines or to following medical advice, will really be a tremendous opportunity for us to impact kind of their overall trajectory of their chronic diseases.
I wouldn't be surprised if in the next 10 to 15 years, every major health system has this program. But luckily, we are the first of its kind in the Kansas City market. We're the first of its kind in Kansas or Missouri. For that reason, I feel extremely proud to be a part of this program.